Hello, my name is Daniel Horowitz, and I am an attorney who represents doctors. Let's talk about the opioid crisis and how it's changing the way doctors prescribe pain meds. Our medical attorneys frequently represent legitimate doctors who are targeted for prescribing painkillers to patients in need. The problem is that their prescription practices do not meet the cookie cutter, one-size-fits-all approach enforced by the medical board and its cherry-picked so-called experts. No doubt the opioid abuse numbers in America are grim. There were over 70,000 overdose deaths in the U.S. in 2021. Drug deaths in general were 108,000 in 2022, and 74,000 of those deaths were tied to synthetic opioids. But statistics can lie, and these statistics are lies when applied to doctors. There is no data that we are aware of that shows how many of those drug-related deaths came from legitimate prescriptions. The Horowitz office has an extensive criminal defense practice. We understand that some doctors use their medical license as an excuse to deal drugs. But really that number is so small that it does not belong in the discussion about the medically necessary prescription of pain-killing opioids. Opioids are still a go-to for serious pain. Radio frequency ablation, 3-level fusions, physical therapy are possible pain treatments, but we know that these often fail, or if they succeed, they provide partial relief at best. And then we have the intractable conditions like cancer, chronic arthritic joint problems, or simply recovering from surgery. The challenge is making sure people who need them can get them without opening the door to misuse. But we object to this concept. What is misuse in a medical setting? And why do politicians on a medical board get to define this medical choice? They shouldn't, but they do. If a patient feels relief and functions better, should a doctor care if the meds also make them feel a bit euphoric? Plenty of mental health drugs tweak mood or thinking. Isn't that kind of a high, too? Can you honestly say that when a pediatrician is prescribing a child Adderall, that this doctor is not changing the child's mood? You can't say that honestly, but it is accepted, and the politicians have not yet put licenses at risk for this behavior control that has significant mood effects as well. To tackle misuse, the U.S. has rolled out things like prescription drug monitoring programs to stop people from doctor shopping. The DEA also ranks opioids by how addictive they are, putting tight controls on stuff like oxycodone. In California, there's Cures, which makes doctors check a patient's prescription history before writing scripts for controlled drugs. Most states have similar programs. These tools help, but they can scare doctors into avoiding prescriptions altogether, even when they're needed. A 2022 study said 40% of doctors cut back on opioids because of legal worries, leaving some patients in pain. The Medical Board of California is trying to find a middle ground, but they can't escape the political pressures that twist their judgment. In 2023, they updated their opioid prescribing guidelines, moving away from strict dose limits and following the CDC's lead to focus on personalized care. How many thousands of people twisted in pain because their doctor bowed to the medical board's threats and cut back on necessary prescriptions? The Medical Board of California has had many missteps. One of the worst was their death certificate project, which they imposed on doctors in 2012. This project targeted doctors linked to opioid deaths, even if they didn't prescribe the fatal dose. It led to over 450 investigations and terrified doctors using threat and intimidation to prevent them from prescribing needed drugs. During the heart of the political opioid attacks, we actually saw doctors on television attacking the opioid pharma companies, claiming that they, meaning the doctors, had been fooled by big pharma and were prescribing opioids without really understanding their addictive affects. Any doctor that's stupid and uneducated shouldn't be allowed within a mile of a patient. This type of fawning obedience to political power is and was very damaging to the medical profession.
Physician lawyer Daniel Horowitz has defended many physicians who are 100% legitimate, but simply do not follow the current, past, and ever-changing political guidelines that interfere with their treatment of patients. If you are such a physician and need legal help, call Daniel Horowitz. Our phone number is 925-283-1863. Call if you are facing a present inquiry or if you were disciplined under the guidelines in effect before the 2023 Medical Board revision. Again, our number is 925-283-1863. Thank you for watching our video.